guess what? When you keep people healthy, when you keep people out of emergency rooms, which is the highest cost primary health care in the country, when you are able to manage chronic diseases, when you, by allowing people to come into a doctor's office, keep them from getting really sick and ending up in a hospital at an expense of tens of thousands of dollars, you know what? You actually save money. Now, isn't that a radical and revolutionary idea? Give people access to doctors, keep them healthy, and you know what? We save money.
If you look over a longer time horizon, the way that CBO traditionally scores things and looks at the decade, we would be talking about saving more than $180 billion in total medical expenditures. And lots of that comes from federal programs. And so for the budget counters, we anticipate that over the 10 years, the federal government would save more than $50 billion in reduced Medicaid costs. States who were very concerned about Medicaid costs would save more than $30 billion in state Medicaid costs. Again, simply related to the expansion of care under community health centers.
You remember last year, Senator, at a hearing, you sort of reared back when I said health centers could save $500 billion a year? We're awful close. Primary care rendered in a health center that's focused on getting people healthy and keeping them healthy can save tons of money. Thought for our dear friend and colleague of Senator Sanders, our beloved friend Ted Kennedy, who was there at the moment of birth 45 years ago when the first health center opened its doors in Boston and in Mississippi, and who said to health centers not so long ago, if you didn't exist, we'd have to invent you. That's the story of health centers. That's what they do today, and that's what they stand ready to do tomorrow.
All right, well, I just want to thank Leighton and Dan very much, and thank you all for coming.